It's extremely important that Lancaster General Health continue to invest in its people and services because we wish to remain at the leading edge of technology so that we can provide life-saving technology to our patients, prolong their life, and really, equally importantly, allow them to live better quality of life. Traditionally, there was really only one approach to treating heart disease as it relates to the valves in your heart, and that was open heart surgery. Now, with modern technology, we can treat valve disease as well as various other abnormalities in the heart with catheter-based approaches that are less invasive and often will not require an open chest operation. TAVR is meant to treat a disease called aortic stenosis, in which one of the valves on the left side of the heart doesn't open fully for patients who just 5 or 10 years ago had no options for the treatment of aortic stenosis. So these patients would end up with congestive heart failure and recurrent admissions to the hospital and really live a very poor quality of life. And now with transcatheter aortic valve replacement, we have the ability to dramatically improve their quality of life. It's important to remember that many of these patients are well into their 80s and into their 90s, but are otherwise very functional people and would like to live productive lives. And this really gives them an option to do that.
So what is an LVAD? Basically, an LVAD is an acronym which stands for left ventricular assist device. It's essentially an artificial blood pump which is surgically implanted in patients with so-called end-stage heart failure. These are patients in whom they're facing death within a year or two because their heart's basically failing. This can be implanted as a bridge to a future heart transplantation, as in younger individuals, or in older people, it can be implanted as a permanent solution for them.
I started to feel tired. Circulation, was finding myself having trouble even walking 15, 20 feet without having to stop and, as I say, let my heart pick up. When I went in the hospital, and of course they'd done a lot of tests, and at that time it was decided something had to be done. And that's when basically the end of January, in the beginning of February is when I had decided on the LVAD. I wanted it done in Lancaster because I felt not only convinced that they could do it, but I really felt that the people doing it were the right people at the time. I was the first one in Lancaster General to have it done on a permanent basis, and it went well. It went well.
The hybrid operating room is a place in which we have ready access to expertise from various disciplines, including cardiac surgery, interventional cardiology, anesthesiology, non-invasive imaging. In addition, we've got ready access to cardiac surgical equipment as well as interventional cardiology equipment. And so we can do procedures that are hybrid between open heart surgery and interventional cardiology procedures.
We, the heart surgeons and the cardiologists, can stand shoulder to shoulder and bring the best of what we both have to offer for the good of the patient through less invasive means and through using state-of-the-art technology.
There's people that as high as 15 to 17 years. And to think at 75, already having it almost 7 years, I'm thankful and I'm grateful. Through them, I'm alive.